the normal structures of the orbit as seen on a contrast enhanced CT scan image. This is a presentation which is made from an article by Griffin et al., who have posted these images in their paper, and they have labeled the images appropriately, starting from the axial sections from the superior to the inferior portion of the orbit, and the coronal sections from the anterior portion to the posterior portion of the orbit. And these are all contrast enhanced images, so we'll see the appropriate structures as we proceed. The items have been labeled from 1 to 37. Now in this section we can see the combination of LPS and superior rectus muscle, which cannot be distinguished separately on a CT scan, and is labeled as item number 1. This is the frontal lobe of the brain, which is seen in the superior part of the section. This is the frontal sinus, item number 3, and being a contrast enhanced image, we can see these two structures which are contrast enhanced, the muscle and the superior ophthalmic vein, and here we have the lacrimal gland, which is also contrast enhanced. Now this is through the midsection of axial section of the orbit, and we can see the two muscles. This is lateral rectus and this is medial rectus. We can see the olfactory bulb of the brain, and these are the ethmoid cells, and this is the optic nerve which is traveling in the orbit and then into the optic canal. This is item number 11, the optic nerve, and the portion in the optic canal and the bony optic canal has been labeled as item number 10. As we move inferiorly, we can see the structures of the anterior segment of the eye, which had been labeled as 19. This is the crystalline lens, this is the ciliary body, and this is the anterior chamber. This is the vitreous cavity, which is labeled as item number 14. And when we look at the posterior part of the orbit, we can see the superior orbital fissure, which is labeled as item number 18, the sphenoid sinus, the pituitary fossa and the gland, and this is the cavernous sinus. Images D to I are coronal contrast enhanced CT images of the orbit progressing from anterior portion to the posterior. Images through the anterior orbits on the soft tissue window demonstrates the extraocular muscles, including the inferior oblique. This is the medial rectus, this is the superior rectus and LPS complex, and we can see the oblique, superior oblique muscle here, labeled as item number 22. And here we have the superior ophthalmic vein, which is labeled as 4, the lacrimal gland in the anterior portion of the orbit, and this is the vitreous cavity. As the section through the middle of the coronal section through the middle of the orbit, this shows us the maxillary sinus, the lamina papyracea, which forms a portion of the medial wall of the orbit, the crista galli, and the cribriform plate. This is 26, is cribriform plate, and the infraorbital canal, which contains the infraorbital nerve and vessels. F, this is the image through the mid-orbit, showing the enhancing extraocular muscles, including the inferior rectus, medial rectus, lateral rectus, and LPS superior rectus complex. Here we can see the enhancing superior oblique vein. This is the optic nerve, which is in the center of the cavity. This is the inferior ophthalmic vein. And we have the infraorbital fissure, which is labeled as item number 30. As we progress posteriorly, the masticator space, which is labeled as item number 13 here, and this CT scan it is not labeled, and portion of the infraorbital fissure. Item number 4 is the superior ophthalmic vein. In this section H, which is the image at the level of the posterior orbital apex, is showing the masticator space, having the masticator muscles. This is the pterygopalatine fossa and sphenopalatine foramen. This last image is through the level of optic canal, and it shows the foramen rotundum. This is the foramen rotundum, and this is the optic canal. The floor is formed by the optic strut. These two are the optic canals, and then we have the Vidian canal. Cavernous sinus is seen here on both the sides, labeled as item number 15.